So I told you the definition of scleroderma is thickening of the skin. Along with thickening of skin, whether there are systemic features or not. Systemic features present or absent. Okay, if systemic features are present only, then you call it as systemic sclerosis. If it's absent, you call it as localized sclerosis. Okay, if it's absent, it is localized. We are not bothered about the localized sclerosis because that's more benign and that's not a connective tissue disorder. We are bothered about systemic sclerosis and localized sclerosis. These both are same, right? Okay, this is what we are bothered about. In systemic sclerosis, so just based on the extent of the disease, we divide it into diffuse and limited. Diffuse systemic sclerosis and limited systemic sclerosis. So this is what is important for us. So how do we differentiate them? First, we'll look at the skin involvement. Next, we'll look at the Raynaud's phenomena. Next we'll be looking at the pH. Based on these things, we'll be differentiating it. So coming to the skin involvement in diffuse, the name itself says. So it's diffuse, it's limited. So the skin involvement in diffuse will be diffuse and in limited will be limited. But how limited it is? So it's limited to below the elbows. So you can see skin involvement only below the elbows. What skin involvement we'll see. Whereas in diffuse, it will cross above the elbow and face is also involving the face. And what is the skin involvement? It is from edematous to fibrotic face. The skin involvement initially edematous, later it is fibrotic. So edematous, you can see her skin is edematous, shiny, tense skin. Slowly it's changing into fibrotic skin where the skin is tightened and difficulty to open the mouth, microstomia and with multiple telangiectasias on the face. So you can see here, initially tense edematous skin, edematous face, which is progressed to fibrotic face where the skin has sclerosed and there is difficulty to open the mouth. The skin will become like this. See here, did you see the mouth? And with multiple telangiectasias. This is how a typical systemic sclerosis presents. So it's involving the face, so it's diffuse. And it can also have salt and pepper pigmentation. If you see here, the pigmentation is hypo with hyper and it's looking like salt and pepper. So it's called salt and pepper hyperpigmentation. Okay, this is about the skin. What did we see in the skin? Initially there is edematous, tense skin. The same with the hands. You see the hands, edematous hands. The same with the hands. Okay. So this is the first difference. Coming to the second difference, Raynaud's phenomena. So Raynaud's phenomena is the first presenting symptom or sign of systemic sclerosis. Before the skin changes and before any organ involvement, patient will be having Raynaud's phenomena for years. So this is the first presenting symptom. In diffuse sclerosis, it is a bit late, whereas in limited, the presentation is bit early, the first presenting symptom. And in limited, there is more of critical limb stenosis. So Raynaud's is due to the constriction of arteries. First there is pallor, cyanosis and redness, right? But in limited, the stenosis is more critical, resulting in limb ischemia. If you see here, see, due to Raynaud's phenomenon, there is limb ischemia resulting in gangrene. That is critical limb ischemia, mostly seen in limited rather than your diffuse. Next, coming to PAH, pulmonary artery hypertension. Pulmonary artery hypertension is seen in both, but in diffuse it is associated with ILD. So when there is a lung disease, there is pulmonary artery hypertension, yeah, it's normal. But in limited, even without ILD, it can develop PAH. It's not always associated with ILD in limited. So these are the basic differences. And we'll see other findings. Now we'll see other findings. So this is the critical limb ischemia. This is the Raynaud's. So when the ischemia, the stenosis increases, it will progress into critical limb ischemia. It's mostly seen in limited. It's seen in diffuse. Done. Now we want to discuss other manifestations of diffuse and limited. So in limited, the other manifestations are crest. In this we know Raynaud's. Raynaud's is the first presenting symptom. C is calcinosis cutis. Esophageal motility syndrome. S is sclerodactyly. T is telangiectasias. So this is crest. In that R is the first thing to present. So what is calcinosis cutis? Cutis, your fingers are calcified. How? So if you see in this image, what do you see in the tips? Calcification, right? That is called calcinosis cutis. So what, that is one part of your crest. Yes, Raynaud's phenomenon we know. And coming to esophageal dysmotility, so this is a secondary cause. Esophageal dysmotility can be primary or secondary. One of the secondary cause for esophageal dysmotility is your scleroderma, resulting in your lax lower esophageal sphincter, so regurgitation of food and vomitings and chest pain. This is how they are going to present. They'll come to you with multiple vomitings. Okay, sclerodactyly. What is sclerodactyly? This tense, shiny, edematous skin on the hands is nothing but sclerodactyly. And telangiectasias, yes, we have seen multiple telangiectasias on the face of that lady. And coming to diffuse, other manifestations are renal, lung and musculoskeletal. In renal, the most important manifestation is scleroderma renal crisis. The renal manifestation of scleroderma is very different from other SLEs and other vasculitis syndromes, because in SLE you will get lupus nephritis, or in other connective tissue disorders you will be getting some other glomerulonephritis. But here it is scleroderma renal crisis, in which patient will present to you with hypertensive emergency. So mostly hypertensive. So if you give a AC inhibitor or ARB, that is fine. So that is the only management of scleroderma renal crisis. Next, coming to lung, it is NSIP pattern, and coming to musculoskeletal, it is arthritis. And arthritis, other tendon problems, tendinitis. So we know what's the skin presentation, how is the Raynaud's phenomenon, how is the pH, and other manifestations like renal, lung, musculoskeletal, and other manifestations in crest like telangiectasis, sclerodactyly, esophageal dysmotility, and calcinosis cutis.